Good day, and thanks for joining me to hear about multiple sclerosis and comorbidities. My name is Megan Weigel, and I'm a nurse practitioner in Jacksonville, Florida. I have an integrative medicine practice called First Coast Integrative Medicine, and I'm an MS certified nurse. Today, we're going to talk about the most common comorbid health conditions that commonly affect people with MS. With the information that you received today, you should be able to describe the impact of these comorbidities on MS disease progression and your lifespan. And even better, you should be able to describe management strategies to reduce comorbid health conditions and their impact on your life. Let's start with what we know. So we talk a lot about how many people have MS. We know that the statistics have increased to tell us that probably more than 1 million people in the United States have MS. 3 to 4 women to 1 man have the condition, and relapsing MS is the most common form. There are many disease-modifying therapies for relapsing forms of MS, but disease-modifying therapy isn't the only part of the MS treatment plan. Relapse management and also symptom management are very important for all types of MS. Treatments for symptoms include medications, rehabilitation strategies, and lifestyle changes. And MS care takes a village. It takes a team of both personal support and healthcare providers to help you live your best life with multiple sclerosis. So here's what you may not know. Many people think, well, I have MS, it's my bad luck, and that must be the only thing I can get. And unfortunately, that's just not the case. You can acquire other medical conditions besides multiple sclerosis. And these other medical conditions can significantly affect your MS disease course and your symptoms. Management of these other conditions is as important as MS management. And many things that we recommend for other medical conditions are also recommended in MS management. So the roads of managing medical conditions definitely cross. And my hope after today's talk is that if you're living with another medical condition, you won't feel as overwhelmed about how to take care of it. Common things are common. Common comorbidities in MS include mental health conditions, diabetes, hypertension, hyperlipidemia, chronic lung disease, overweight and obesity, and ischemic heart disease. In the general US population, you can see that, well, common things are common, and you see similar things as you do in MS: heart disease, cancer, chronic lung disease, stroke, Alzheimer's disease, diabetes, chronic kidney disease, and mental health conditions. Now, some of these conditions like heart disease, stroke, and diabetes are associated with things like overweight and obesity. So there's more crossover than it looks on this chart. The red V next to the conditions in MS notates them as vascular comorbidities, and I'll show you why that's important. One vascular comorbidity increases the risk of reaching an EDSS of 6 by 6 years. That means it increases your risk of needing a one-sided walking assist by 6 years. If you have 2 of those, your risk of disability progression increases by about 200%. So are there other impacts from these conditions? Well, yeah. So depression, diabetes, and ischemic heart disease are associated with an increased risk of death that's similar to the general population. Any comorbidity is associated with a twice higher risk of non-MS related hospitalization with MS. So that means a person with MS with any comorbidity is twice as likely to be admitted to a hospital because of a complication from diabetes, hypertension, heart disease, lung disease. Obesity at age 18 has been associated with a 2-fold increase in MS risk. Comorbidities also can delay recognition or diagnosis of MS because symptoms are related to other problems. So, for example, a person who may have had multiple strokes and is having more neurological problems might chalk those up to having strokes, when in effect, eventually a diagnosis of multiple sclerosis is made and the person had several strokes. Also, we can't state enough the financial impact of increased healthcare costs, including accessing the healthcare system, taking medications, making sure that your diseases are controlled. Risk factors for comorbidities in MS are many. The influence of diagnosis of a chronic condition can cause isolation, fear of the unknown, role changes, and a loss of a sense of independence that can cause mental health conditions. Avoidance of the healthcare system because you're just sick of it all can mean that time goes by when you could have had a condition recognized in its very early phase so that it didn't progress. So, for example, pre-diabetes or pre-hypertension, if you're told in an early phase and maybe you lose some weight, then you no longer have hypertension or you no longer have high blood sugar. Also, with multiple sclerosis, if you have mobility issues, then there can be a decrease in physical activity, which then sets you up for other conditions. And then medication side effects. So long-term or frequent use of high-dose steroids can cause changes in weight, changes in your metabolism that affect your blood sugar, your cholesterol, and also even your blood pressure. And the long-term side effects of particularly older antidepressants and anti-seizure medications that we use to treat MS symptoms can also cause weight gain and other issues. Some medications can cause hypertension. So it's important to know that some of the things that we do, we can't control, but many of the things that we do, we can control. What can you control? What can you do to prevent and manage comorbidities? Well, the first one is don't avoid your yearly checkup. Trust me, like I say here on this slide, you will end up with more doctors and you're already sick of going to the doctor. So if you go to the doctor based on your age and sex appropriate timing, for example, once a year for a woman, once a year for a man, maybe every 6 months, depending on your age, then the healthcare provider can pick up on signs that something may be changing and you need to look into it more. Make wellness a priority, because when you do, you make yourself and your future a priority. Make lifestyle changes, because most of them are cheaper than medications or taking more medications. Make SMART goals and take medications and keep follow-up appointments as directed. A lot of research supports the use of lifestyle changes in the prevention and management of comorbidities common in MS, those vascular comorbidities. But research regarding lifestyle changes and their effects on MS is in the adolescent phase. And what I mean by that is there's some research, but people argue about it and aren't sure what to do, kind of like adolescence. So what's the best thing that we can recommend? Well, we know for sure that addressing lifestyle has a positive impact on vascular risk and comorbidities. We also know from studies that addressing these areas can have a positive impact on MS symptoms and perhaps on the course of the disease. An example of this is high blood pressure actually worsens white matter changes in the brains of people living with MS, which means that there's an increased risk for motor or mobility and cognitive disability later on. And it's all connected, right? So better sleep equals better mood, healthier food equals better mood, exercise equals better sleep, better mood equals better choices. So you can pick one and affect all of the others. Let's talk about these one by one. First, we'll start with food. Eating a plant-based diet that is rich in color, rich in variety, rich in nutrients, high in omega-3 fatty acids and whole grains, and low in processed foods is a great place to start your food cleanup. The Mediterranean diet and the MIND diet, which is a combination of the Mediterranean diet and the DASH diet for hypertension, share the most data combined for benefits in MS and vascular comorbidities. So if you haven't made any diet changes and you're interested in doing something that is relatively easy and not hard to find, not expensive, I would start with a Mediterranean or MIND diet. If an item has more than 5 ingredients or ingredients you can't pronounce, don't buy it. Why? Well, we want to try and decrease the processed foods that you're putting into your body. And then eat colorfully. So vary your fruits and veggies. Back in the olden days when we were farming on a more, let's call it basis based on the weather, we didn't eat strawberries all year long. We didn't eat apples all year long. We ate them in their season. So choose fruits and veggies according to their season. And that way over the year, you're getting in more nutrition, more varied nutrition. There isn't one MS diet. There are a lot of them out there. And truthfully, most people can look at many of those diets and say, that diet's not for me. I'm not going to do it. So just know that the right one is the one that you will follow, and let go of the fact that you're missing out because you're not doing something that one of your friends with MS is doing. As long as you're eating healthfully, you're making good choices for your MS and for your vascular conditions. The recommended dose of exercise is 150 minutes of moderate aerobic exercise per week, plus strength training twice a week. Exercise may be different depending on how movement has changed for you, and that's okay. If you need someone to help you move your extremities and that is increasing your heart rate, then you're getting exercise. If you can no longer run at the pace that you used to or comfortably, then you walk. If your balance is off and you enjoy cycling, and cycling outside may be dangerous for you, maybe you use a stationary bike. Maybe you try some chair yoga. Maybe you dance. There are so many different things that you can do for exercise, but you just need to do it. That 150 minutes a day translates to about 22 minutes a day. 150 minutes a week translates to about 22 minutes a day. Make sure you're moving your body at your best time of day. It is totally fine from a cardiovascular standpoint to separate your exercise. So if you tucker out after 20 minutes, then do 10 in the morning and 10 in the afternoon. Use cooling equipment. Doesn't matter where you live. You could live in Colorado, you could live in Florida. When your core body temperature increases, if you're sensitive to heat, some of your MS symptoms may get a little bit worse. So you might have an Uthoff's phenomenon where your vision in an old optic neuritis eye starts to blur, or maybe you feel more tingly, or maybe more spasticity or weakness. If you use cooling equipment to cool down your core body temperature, those symptoms will be less severe for you. And then always stay hydrated. Ask your healthcare provider for a referral to a physical therapist to help you create a safe and effective exercise program, particularly if you're dealing with a new normal or changes in your mobility status and your ability to move that prevent you from doing exercise like you've known it for a long time. Sleep is another great part of lifestyle that you can feel empowered to have an effect on if you make it a priority. So one of the things that I'm familiar with right now is people binge watching TV shows. And they stay up till like 2 or 3 in the morning, my patients tell me. Please make sleep a priority. You can always catch up on a show. It's clearly not going anywhere if we're able to binge watch on them. If you have a hard time going to sleep, create a calming bedtime ritual that gets your body ready for it. So, you don't want to be watching a scary show 10 minutes before you go to bed. And might I just say that you probably don't want to be watching the news before bedtime either. Calming rituals that many people like are creating a gratitude journal and writing down 3 things each night that they're grateful for that day, doing some gentle stretching or even yoga before bed, doing a meditation. There are so many apps with bedtime meditations, diffusing essential oils, or drinking an herbal tea if that's not going to send you to the bathroom all night long. A great essential oil to diffuse to help with sleep is lavender if you don't have a sensitivity to that. If you like to read before bed, consider using a blue light blocking filter or glasses so that blue light, which can affect your sleep hormones, is blocked. And avoid eating dinner late. Avoid processed sugar. Avoid alcohol and caffeine within a few hours of bedtime. And some people say, well, wait, I need to have a glass of wine in order to go to sleep. And actually, that glass of wine may make you feel sleepy, but it's completely disrupting your sleep cycle. So evaluate your sleep. Do you have a hard time falling or staying asleep? Do you snore? Do you move around a lot at night? Are you restless? And if so, it's important to talk to your provider about an appointment with a sleep specialist. I don't think we can focus enough on stress management. There are very obvious stressors in life, and then there are some that are more subtle. Eliminate the obvious ones. If you can feel your heart rate increase or your neck and shoulders get tense when you're watching the news or browsing social media, then limit it. Limit it to 5 or 10 minutes a day. Take the app off your phone. Just don't give yourself access to it. Learn to say no to what isn't on your priority list. Start a daily mindfulness practice. Get an meditation app. So many are free right now on your phone. Practice deep breathing. Just stopping and taking 10 deep breaths can be very effective. Consider yoga. You guys might have figured out that I'm a huge fan of yoga, and I really believe in the positive effects that it can have on the mental, emotional, and physical body. Use the arts to manage stress. Listen to music, play music, look at art, color, write. Any of those crafts, knitting, crocheting, all of those things can be beneficial for stress. Gardening is another one. Connect with others virtually, connect with others in person safely. Right now, making sure to mind the precautions that we all need to mind right now, and get outside, get fresh air. It is probably the best medication. Depression and anxiety are common in people living with MS. So if you have had symptoms of depression or anxiety for most days out of the past 2 weeks, it's really important that you talk to your healthcare provider about how to improve those for you. And it might be with talk therapy or medication or both. So let's talk about setting a SMART goal. I think that it would be really awesome if you could pick one of these categories after listening to this talk and say, I'm going to set a SMART goal, and I'm going to make one of these lifestyle changes, and I'm going to make it easy. SMART goals are specific, they're measurable, they're achievable, they're realistic, and they're timely. So let's give an example. Here's a specific example. I'm going to go a week without drinking soda. The wrong thing to say is I'm never going to drink soda again, because you might be setting yourself up for failure. But going a week without soda is measurable, yes, because I don't have to have it in the house. Or if there's a 6-pack of Coke, I can see that there's still a 6-pack of Coke at the end of the week. Is it achievable? Yeah, I'm pretty motivated to do this. I can go a week without soda. Is it realistic? Yeah, because I'm not going to die without soda, and it'll actually save me money. And maybe my kids won't drink it either if I don't bring it home. Is it timely? Yeah, because I had a visit with my doctor last week and I learned my blood sugar was borderline high. So it's really a good time to set a health goal. So there's a SMART goal example for you. Hopefully that will help you with making a great lifestyle choice that's a change for you that can help improve your health. As Jimmy Huga, the founder of Can Do MS, said, focus on what you can do. So set yourself up for success, make some great lifestyle changes, improve your quality of life and your wellness, living with MS and other comorbidities. Thanks so much for listening to this talk today. I hope it was helpful. Have a great day.